A lot of times insurance companies deny claims not because the service wasn't indicated, but really because of missing information. So incorrect billing codes or how the claim was submitted.
Yeah, can you give us an example of how this happens?
Sure. So let's, for example, say someone goes to an urgent care for chest pain. The doctor orders a EKG, some blood work maybe, and a chest X-ray to rule out some underlying serious diagnosis or to rule out anything serious. But later, the insurance denied the claim for the EKG, saying it wasn't necessary because the final diagnosis was a common cold.
That sounds so frustrating, right?
Yes,
So obviously the EKG was necessary to rule out something serious.
exactly. But it's hard because the insurance company was only really getting like a little picture of this, like in the coding. So there's so much, I guess, issues with communication. A lot gets lost in translation, if you would say. So they need to get more information often. And so the insurance company just sees the cold diagnosis and an EKG charge. They don't see the reason why it was done. And that's why understanding how medical bills work and how to appeal medical claims is really, really important to understand.
Yeah, that's right. So let's say someone gets a bill like this, and what do you think is the first step in fighting an insurance denial?
Well, in most cases, it's really a multi step process. And often, what we do at Pathway Patient Advocate is the following: we review the medical bill or bills, and then any necessary medical documentation to see what was actually coded and if it aligns with the services that were actually performed. And then often, really, the coding is not complete. So, and that's like a big error to like kind of pick up during your initial review. So sometimes an accidental typo of one number in the coding can cause a rejection. A simple transcription error of one number will cause, or can potentially cause thousands and thousands of dollars to be rejected inappropriately. The next thing is really reviewing the insurance policy to see what's covered in the policy. For example, is the deductible met? What's the out-of-pocket cost? Is it a network? What is the cost sharing and all of that? There's so many different even definitions that a lot of people and new terms that kind of it's easy to get confusing and not understand and feel overwhelmed.